So now we look at tier 3 accumulation. Remember, that's communication, teamwork, patient and family education. It's that admission, transfer, and discharge. It's bedside shift report. It's all of those things. And so now the orientee will demonstrate completion of an admission, transfer, and discharge. They'll make use of that respectful communication strategies with all the members of the healthcare team. They'll take part in communication and collaboration with interprofessional team to provide safe and effective coordination of patient care. They make use of SBAR when they're reporting patient information to providers. And they're going to model that bedside shift report. Remember, they've been watching the preceptor in tier 1 and tier 2. And so now they're going to do that handoff, that nurse to nurse handoff themselves. And they're going to identify patient and family readiness and ability to learn. And so we're going to use that same background of that 49-year-old male that underwent an emergency appendectomy during the night, went to the surgical unit at 4 o'clock in the morning and used a PCA. So that they went through, they're still in the anchored state, the preceptor and orientee walk into the patient's room. The orientee immediately takes the vital signs, performs a full head to toe assessment, even with the level of consciousness checks. Now it is appropriate for the orientee to look at that PCA pump for dosage used by the patient. The orientee is concerned by the change in the patient's vital signs from what was documented at 4 o'clock. And so with all those changes that Angie talked about, the orientee also notes that the patient is difficult to arouse, and he was alert when they did that 7 o'clock bedside shift report. So now the orientee immediately calls the rapid response team, alerts the charge nurse of the patient change in status. The orientee notifies the surgeon of the change in the patient's condition and receives new orders for the PCA. And then while waiting for the RRT to arrive, the orientee initiates the new PCA orders, takes another set of vital signs, and documents all in the patient's EHR. And so here we are going to trust that they have achieved competency. And Angie has nicely triggered me to read the competency to you. And that is to identify changes in assessment and reassessment, adjust plan of care or department-specific care plan, and document accordingly. So you can see through this case study at this point, the orientee has become competent with this KSA. So you would mark, if you were the preceptor for this orientee, that you trust them to do this KSA independently because of all those things that they did. They called the RRT, they initiated new PCA orders, they took another set of vital signs, and basically they've done a complete assessment of that patient when they've had some changes in their status.